Welcome back to Health in Today's Woman. Today we're discussing heart disease with Dr. Britt Miaton, an invasive cardiologist at St. Thomas Heart at Middle Tennessee Medical Center in Murfreesboro. You'll notice in our first segment I mentioned that 13 million Americans are dealing with coronary artery disease or heart disease. In this last segment we want to discuss ways to prevent you from becoming a statistic. Britt, thanks again for joining us in this last segment. I kind of want to do things a little bit differently. I want to kind of turn here because we're going to talk about some of the risk factors that are associated with heart disease. And the first one I want to talk about is obesity, because I think it's such a huge issue in all medicine, this whole idea of obesity. How does it affect heart disease?
Well, obesity, Kelly, is actually a primary risk factor for heart disease, along with the other well-known risk factors such as tobacco use, high cholesterol, high blood pressure, diabetes, and a family history. Obesity is becoming a major epidemic in the United States. We see our young children who are carrying a lot of extra weight nowadays. Diabetes is actually being seen in teenagers. These are things that hadn't been seen before. And it can contribute to the increase in incidence of heart problems because it leads to high blood pressure. It leads to increased risk of diabetes through insulin resistance. And it tends to be associated with high triglycerides or certain types of fats in the bloodstream.
And these are all important things, I'm assuming, in heart disease. Is the patient who's obese at higher risk for heart attacks than the person who's not?
Right. The risk of, if one is obese, it does increase your risk for coronary artery disease. In fact, there was one study that indicated it in truncal obesity. When we talk about obesity, it's abdominal obesity. Women, for instance, that have a waist size greater than 30 inches have a larger or a higher incidence of coronary artery disease than women who are thinner.
That's interesting because I think a lot of people don't know that. I remember I was always having a discussion with my cousin who's a general surgeon, and really you can take probably 70% of the patients in the hospital anymore, and you can relate it to obesity. You know, if you took 95% of the patients and related them to obesity, smoking, and old age, you'd have the whole hospital. And so I think it is such an important issue and something that we really do need to address in today's society because it is a big issue. One of the things I want to mention, though, is you mentioned diabetes, and I know diabetes can be a real problem in heart disease because diabetics don't present the way other people do either, right?
Right. Diabetes is a disease which can affect many aspects of many organs in the body, including the nervous system and the sensory nerve. So not infrequently diabetes, or people who have diabetes, won't have the typical symptoms of chest discomfort that we might see in non-diabetics because the sensory nerves of the chest are affected by the process.
And that's interesting. And of course, sensory means the feeling. I think a lot of people wonder these things. Sensory just means feeling. Let's move on to the next thing, and that is the whole idea of cholesterol. You know, all of us see the number of commercials that are out there versus trans fats, and should we use margarine, should we use butter, all these things that are kind of involved. How does this whole idea of cholesterol fit into heart disease?
Well, cholesterol is one of the major recognized risk factors for coronary artery disease. There's a direct relationship. There's no cholesterol level at which there's no coronary artery disease. And as your cholesterol level increases, your risk of having heart problems increases directly with that. And there are many studies that have demonstrated that if you have somebody who has a high cholesterol and you lower it either through diet, exercise, or medication, you will reduce their chance of developing coronary artery disease. So there's a direct relationship between one's cholesterol and the potential risk for heart problems.
And one of the things you're discussing kind of at the break was this whole idea of there's some development of statins that are medications that do lower cholesterol, and these really have had a huge impact on heart disease and the way we're treating it in this century, isn't it?
Yeah, statin drugs are an incredible advance for medical therapy. They actually have been shown in many studies to be effective in primary prevention, which means preventing heart problems from developing in people who've never had them before, as well as in secondary prevention, people who've had heart attacks or have been diagnosed with blocked arteries, preventing them from having future problems. And the degree of lowering of risk is oftentimes in the range of 40 to 50%. So they really are very, very effective medications when used in proper doses and monitored appropriately.
And that's incredible, the fact that we have made that much of a difference in this century. People don't realize we have this huge healthcare debate going on now. We have made some major advances in healthcare in the last, 20 years. Statins are what, about 15 years old, 20 years old?
Probably 80s. I think 80s, 90s. Yeah.
So you're not talking very long ago. I mean, I graduated from high school in 1986, and it's
Right.
amazing the changes that have occurred just since then. And I actually graduated from medical school in 2000, and it's amazing the changes that have occurred between 2000 and 2009. The last thing I want to talk about is the whole idea of heart diets. I think that we see a lot of this kind of stuff on the internet. People talk about it. I want to talk a little bit about, are heart diets safe, and what kind of diet is a good idea for patients to be doing to prevent heart disease?
Well, in our practice, we don't recommend fad diets per se. We don't advocate any specific diet, the Atkins diet or the South Beach diet or the sugar diet. The best diet really for reducing the risk of heart problems is what you would call a Mediterranean type diet, one which is high in fiber or grain, fruits, vegetables, fish as opposed to red meat, and low in fat.
And one of the things I want to mention, because we've got a little bit something special here, this is put out by the St. Thomas Foundation, is that correct? And the proceeds go to the Foundation for St. Thomas Heart. And it's a really good cookbook. They have two of them. You can get this on their website. But there are some things that you can do. There are things out there that really are positive for trying to teach people who say, I don't know how to make a Mediterranean diet. I don't understand what that means. But there are some positive things out there.
Well, you're right, Kelly. The cookbook is one measure, and St. Thomas has sponsored cooking classes, and you can get a schedule for those classes through heartisone.com. They're held twice a month throughout Middle Tennessee in various locations from September through May. And if you want to go to their website, you can get a schedule for when those classes are held and the location at which they'll be held.
And I think that's really important because I know there's people out there watching that are saying, well, I don't know what a Mediterranean diet is, but I'll tell you what, we can show you what a Mediterranean diet is. Just go to that website, and this cookbook and other opportunities are offered by St. Thomas Heart here at Middle Tennessee Medical Center. We'll be right back after these messages.